give maybe one more minute or so for folks to sign on, and then we'll go ahead and start. But I did want to let everyone know that we are recording today's webinar. If you have any questions during the webinar, that you're able to put your questions into the Q&A box at the bottom of your screen. There's also a chat function there just to have discussion throughout the webinar. And so we'll give it one more minute, and then we will start. So thank you all for joining today. Good afternoon, everyone, and welcome to today's webinar on Youth Protective Factor Study, Supervision Based on Risk, Strengths, and Development. We are joined today by a wonderful cast. Just as an aside, we are going to make sure that this is recorded. This will be available on the website today. Not today, sorry. It'll be available later this week or early next week. But just a reminder, please put your questions in the Q&A. We'll have time to get to them at the end of the session. We'll get through as many as we can. And with that, I will go ahead and turn it over to Josh Weber, who will begin our webinar and begin the presentation. So thank you all for joining.
Thank you all for joining. We appreciate your time this afternoon. We are excited to talk to you about the Youth Protective Factor Study. This is the second webinar in a series to discuss key findings from this innovative and unprecedented study. Next slide. Just a little bit about the Council of State Governments Justice Center. If you're not familiar with us, we're a national nonpartisan nonprofit organization. We work with all branches of state government as well as local government to improve outcomes for youth and adults in the justice system. Next slide. I oversee our youth and juvenile justice work at the Justice Center, and I have for a decade. And over that time, we've had the opportunity to work with many states as well as counties all across the country to help improve outcomes for young people in the juvenile justice system through evidence-based, consensus-based approaches. I'm very pleased to be joined by the primary investigators on this project, Dr. Jennifer Skeem and Dr. Gina Vincent, and they will introduce themselves in more detail when they share some of our findings. Next slide. I want to talk just briefly about the background of the Youth Protective Factor Study, why we think this study and its findings are so important right now. Give an overview of the study for those of you who may be less familiar with it, and also share just briefly about the initial findings from our first brief and webinar. If you have not seen that first brief, we encourage you to take a look at it on UMass's website. And then we will talk in more detail about this most recent brief and our most recent findings. Next slide. I'm sure all of you are experiencing these challenges in your jurisdictions, but I think it's fair to say that this is one of the most challenging times for juvenile justice that the country has seen in many decades. Certainly, public concern, policymaker concern, media coverage, political divisiveness on youth crime, on youth violence is at levels that we really haven't seen since the super predator era of the mid 90s. Unfortunately, we're seeing a number of states respond to those concerns with more regressive policies that are making it easier to detain and incarcerate more young people. And so this is a critical time to really focus on what do we actually know from research really works in terms of both predicting as well as preventing youth reoffending and promoting public safety and improved youth outcomes. Next slide. Overall, youth arrests for youth crimes is historically low and has been trending down for decades. Generally, the same thing is true for violent offenses committed by young people. Compared to the mid 90s, violence overall is actually down about 50%. But what has been changing over the last decade or so and really accelerated post-pandemic was an increase in the most serious form of youth crime, and that's homicides. And now, unfortunately, homicide and suicide are now the leading cause of death among children and young adults, particularly youth of color. In about half of cases where a young person has committed a violent crime, the victim was also a young person. This violence and the rate of firearm deaths particularly impacts Black youth and youth in rural communities. And so we do have a responsibility to try to make sure we identify the young people that are most at risk of violence and victimization, and ensure that we are developing and implementing evidence-based strategies to provide those young people with the services and supports they need to address their risk factors. Next slide. What we also know is at the same time as communities are experiencing this rising concern around youth crime and violence, while the most serious form of violence, homicide, has been on the rise, adolescents are also experiencing significant challenges when it comes to behavioral health. Again, many of these challenges started prior to the pandemic, but have accelerated since the pandemic. This is data from the CDC survey of all high school students completed in 2023. And you can see that almost 1 in 3 high school students reported that their mental health was not good most of the time or always. 40% of all high school students said that they felt sad or hopeless, and that's compared to 26% in 2009. Somewhat shockingly, that includes more than half of girls and almost 2/3 of LGBTQ students. As a result of that, 1 in 5 high school students seriously considered attempting suicide. And while generally substance use, alcohol use, tobacco use among high school students is on the decline, overdose deaths spiked during the pandemic by over 100% and remain elevated today. And most jurisdictions don't have a ton of robust or effective behavioral health services, so it complicates the picture and the need to be really strategic about resources and services when it comes to young people. Next slide. And the final challenge in this mix, as I'm sure many of you are experiencing, is unprecedented staff hiring and retention, staff turnover challenges. This is data from a survey nationally that we did of juvenile justice agencies last year. 85% cited moderate or severe challenges in hiring and retaining staff. 80% reported moderate or severe staffing challenges amongst their service providers. And most strikingly, most survey respondents, we had hundreds of responses from all across the country, felt like their state policymakers, state leaders were aware of these staffing challenges, but less than 10% of respondents felt their state had a plan to address these staffing challenges. Next slide. So putting all of this together, the Youth Protective Factor Study really is directly aimed at trying to provide critical and unprecedented research guidance to help jurisdictions that are struggling with this complicated mix of issues. The protective factor study, we partnered with 3 states and 14 counties in those states, and worked with them over the course of over a year, and were able to work with, include in the study, thousands of young people. And we were able to do a couple of things. One is to track recidivism rates for all of the young people in contact with the juvenile justice system in these counties, and track new petitions for any offense and adult offense, and including violent offenses, not just during supervision, but for an average of a year and a half post supervision. As we'll get into in a little bit, we developed detailed service tracking instruments for each of these states so that they were able to track and categorize all the services that these young people received. Each of the states had been using risk assessment tools, and we helped them to adopt the protective factor survey instrument that we'll talk about in a little bit. And so the study overall is really an attempt to look at what risk factors matter, what protective factors matter, and what is the relationship between receiving services and different types of services when it comes to recidivism reduction. And obviously this work is particularly critical right now, given these challenges that states, counties need to be increasingly strategic and deliberate and thoughtful about how limited resources are used for case planning, supervision, and services, which young people to target, what risk and protective factors to target, and how best to organize case planning and services. And so really excited about the opportunity to share some of those findings with you today. Next slide. And so just a little bit, again, encourage you to go to the UMass Chan Medical School website and review in detail the first protective factor study brief, but wanted to share a couple of the key findings that we highlighted in that brief before we get to the most recent findings. The first is that our data and our analysis of young people's involvement with the juvenile justice system and post-supervision, at least a year and a half, showed that most young people, not only did they not reoffend after supervision, but of those that did, the vast majority did not commit a new serious offense, a person offense, or a violent offense. And so while we should be concerned about all of the issues that I just laid out, we should be concerned around any young person who engages in violent behavior. The reality is this study affirms what a lot of other research has shown, which is the vast majority of young people are not reoffending, and certainly not reoffending in a serious way post-supervision. Secondly, what we also found, though, is that the risk factors that were most prevalent for young people coming into contact with the juvenile justice system in the 3 states, particularly risk factors like leisure time and substance use, were not the factors that were most likely to predict more serious reoffending after system supervision. Those risk factors included personalities, attitudes, and behaviors, as well as family challenges. And so these 2 findings in combination really highlighted the importance of having a light touch with low-risk youth and trying to divert low-risk youth whenever possible. But for young people that are involved in the juvenile justice system, having a individualized case planning and supervision and service approach, and really focusing on those key risk factors and related services like cognitive behavioral therapy and family therapy that address those risk factors that mattered most for reoffending. And then finally, while we found that substance use weakly predicted reoffending for the overall youth population, one of the other key aspects of the youth protective factor study is to look at age differences. And we did find in our first analysis that more serious substance use was a relatively strong predictor of person reoffending amongst younger adolescents, 11, 12, 13 years old, than it was among older adolescents. And so substance use could be seen as kind of a red flag for potentially more intensive intervention and support for those younger kids. So background, some of the initial key findings, and then we'll share the second set of findings with you. We'll have some discussion questions. I'm sure you all have lots of questions. We encourage you to put those in the chat because we made this webinar 90 minutes because we wanted to allow time for a robust discussion afterwards. So as we move forward, please place those questions in the chat so we can track them. Gina?
All right, thank you, Josh, and good afternoon, everybody. Thank you for joining us today. I'm Gina Vincent. I'm a professor at UMass Chan Medical School, and I co-direct the Law and Psychiatry program there. I'm also with the Implementation Science Practice Advances Research Center, and otherwise known as iSpark. And I just want to say I want to acknowledge our research team who were all listed on Josh's first slide and did amazing work on this project. And I also want to thank our states who were involved. They did a lot of work with us, Pennsylvania, Wisconsin, and Virginia. As we are going through the results, as Dr. Skeem and I go through results today, we will have all the states de-identified. And I want to just be clear that the order in which we are showing them is not the order in which they just appeared on Josh's slide, because they are truly de-identified. I also want to just acknowledge my terrific colleagues who I've really enjoyed working with on this project, Josh and Jennifer. And with that, I'm going to launch into our very first aspect of the project that we're going to discuss with you today, and that is the protective factor survey that we put into place with these states, or that we helped the states put into place. I'm going to cover the methods, what the protective factor survey measured, what the kids look like generally. And then Dr. Skeem is going to go into the detailed results about what protective factors actually predicted post-supervision violent recidivism. So to start off, we designed a protective factor survey to measure 4 main domains of protective factors that we hypothesized were going to matter the most. We define protective factors here as something that precedes and decreases the likelihood of recidivism or reoffending. It's not merely the opposite of a risk factor. It's got to be something different from that. And we selected protective factor domains that would be dynamic, theoretically could be changed through an intervention, that are theoretically associated with desistance from delinquent behavior. These were all of the probation officers administered these to youth alongside their risk needs assessment. That was the idea. And so therefore, some of the sample came from youth at the intake level, probation intake, when they were first referred to the juvenile justice system. And other youth in our sample would have been further along, so they would have been post-adjudication predisposition. That's just important to keep in mind when we're thinking about the risk levels of these youths and their protective factors. Despite the amazing work from Rachel Peralta, our previous program director or project director, who really tried to track down all protective factor surveys for everyone in this study, all the youth that ended up in our sample. There were still about 1,400 youth missed. So we got protective factor surveys from 58% of the whole sample that Josh showed you before. But this was not because youth refused or because they couldn't complete the survey. In fact, it was quite the opposite. As you see the numbers there, very few had challenges completing the survey. It was developmentally appropriate after we did a little tweaking based on probation officers' input, and very few refused. What happened instead is some youth came into the system and were dismissed so quickly or counseled and closed so quickly that the probation officers just didn't have time to get the protective factor survey done. By the way, this was self-report, so youth just read it and filled it out on their own, or they completed it on a computer. And because we got just about half of the sample, I do want to acknowledge that there is a slightly less than expected white youth in our sample and less than expected low risk youth in our sample. Those were the ones who were just kind of cut off the top and didn't have time to get the protective factor survey. But we still have a very robust breakdown of race and ethnicity in the sample and age in the sample. So I want to just quickly cover the 4 protective factor domains that I identified to measure. One is pro-social identity. So we know that youth who see themselves as pro-social are less likely to engage in violent behavior and delinquency. And we measured this with 2 measures where they were given a series of adjectives and asked the extent to which this pro-social trait defined who they want to be and how important these are. to their identity. So things like generous, respectful, truthful. The second domain that we measured was pro-social engagement. So increasing engagement in school, employment, and civic responsibilities can be protective against delinquent behavior and violence, and is also a primary goal of positive youth development. We followed a lot of the positive youth development ideas and concepts when we were measuring protective factors here. So in this domain, we had several measures, 3 measures, looking at school connectedness, so how bonded were they to school. One looking at their sense of purpose, so the extent to which they had purposeful goals and pursuits, and the other that had to do with their engagement in the community and their attitudes about adolescent social responsibilities. The next 2 domains are presented on this slide, and the first has to do with just general social support. So individuals with interpersonal skills who are able to maintain relationships and who have positive relationships in their life are more likely to have a sense of belonging. That's also a tenet from positive youth development. And we measured both pro-social support from peers and caregivers in that area. And then lastly, we were very interested in looking at both self-control and self-efficacy. So how able is the youth to control their emotions and behavioral responses to a problem or a situation? And second, how much do they believe in their ability, in their own ability to handle life's difficulties? That's what self-efficacy measures. So those were our 4 domains. I'm going to start by showing you just how the overall sample looked and how they scored in this. Now, I want to acknowledge that none of these protective factor measures have cutoff scores. So we needed a way of determining, who's kind of a high scorer versus who's a low scorer. And we did that statistically by looking at the best cut point on each scale that separated that separated individuals where only 15% had recidivated versus the rest of the group. And we created cutoff scores basically based on recidivism rates. We were very both pleased and I'd say surprised to find that youth in the juvenile justice system, or referred to the juvenile justice system, actually had quite a lot of protective factors. So as you can see here, and the bars are by the different scales that we measured, there was a lot of youth who had a pro-social identity, 80% on one of those scales and 60% on the other. That was quite high. Youth also tended to be very high in their general self-efficacy. So whether they found themselves or thought that they would be able to help handle life difficulties. I also just want to point out that when we compare the scores of the youth in this juvenile justice sample to youth in the general community who have completed these measures in other studies, there weren't a lot of differences. They actually were scoring relatively similar to youth in the general community. One area where that was not the case was really on school connectedness, and the other area was in social control, or self-control, sorry, where the youth in our sample scored lower than you would see generally in community samples. Now, one last detail before I turn this over to Dr. Skeem, who's going to talk about the prediction for violence, is that we want to acknowledge that our states were very different, and because of that, the youth coming from these states were very different, and it's going to necessitate separate analyses and all of the analyses that we're showing you. So we did all of our analyses by state. As you'll notice, there's just a couple things I want to point out. First of all, state 1 had the largest sample, so it was the most well-powered group. So we were able to detect small effects in this age with these folks. They also had a very small percentage of youth who were high risk. State 3, they did the protective factor survey later in the juvenile justice process, and so they had the highest percentage of high-risk kids in this sample, and consequently also had the highest recidivism rates for violence post-supervision. Another thing that made them different. And then what was really different about state 2 is not only was the sample the least well-powered because it was so small, this is our youngest sample. So on average, these youth were 14, which is significantly different from what we generally see in other states among youth in the juvenile justice system. So for these reasons, we had to look at state results separately. And with that, I'm going to turn it over to Dr. Skeem.
Thanks, Gina. And I just want to echo Gina's thanks. Sorry, Dr. Vincent. Thank you for our research team. This study was a lot of effort, and what you're seeing here reflects the work of many people on the research team in the agencies and beyond. So just a note of thanks to everyone. I want to specifically thank Louis Gian, who ran a lot of the sophisticated analyses that I'm about to share now and did so very well. My name, again, is Jennifer Skeem. I'm a professor of public policy and social welfare at UC Berkeley and have been doing research at the intersection between mental health and risk for involvement in the justice system for quite a while. And this study has been very exciting. So let me share the results without further ado. The focus of this second brief is in part on which protective factors most strongly and also most uniquely compared to risk factors protect young people against reoffending. So that's really the first question that we'll walk through. And the second is whether some protective factors matter more for younger people than older people or vice versa. So next slide. As Dr. Vincent said, we needed to do these analyses separately by state because recidivism rates varied by state and the populations varied by state a bit as well. So at the top level, what you're seeing here are the results of survival analyses where we looked at how long young people were able to be in the community after supervision without reoffending. So you can see here that we've got 3 blocks, one for each state. Everything is color coded throughout this, so you can keep track of the states. The top blocks show you the protective factors for any recidivism post-supervision in that state. And the bottom blocks show you the protective factors that mattered for protecting against violent reoffending in each of the states. So we controlled for age, gender, and race here. So these are effects that we expect to generalize across different groups of young people. And what you can see, the take-home message here is that self-control significantly protects against reoffending of both sorts, any and violent reoffending across the states. But in our best powered state, so in the state that had the largest sample, you can see that all 4 of the protective factor domains that we measured are significantly protecting young people against one or both forms of reoffending, which is exciting. Of course, we selected these protective factors very carefully. We wanted to make sure that what we were measuring was not just the opposite or inverse of a risk factor, but actually unique protective factors that were relevant to adolescents, emphasized or consistent with a positive youth development model, and really seemed to be getting at something beyond just the absence of risk. With all of that said, it's still very important for us to look at the unique predictive utility of these protective factors. So in the next slide, we control for youth's level of risk, so how likely they were to reoffend based on each state's total scores on their risk assessment tools. So they were each using validated measures of the risk of reoffending, and we controlled for that in this second look at which factors matter the most. This slide focuses on the less serious form of reoffending. So this is any kind of reoffending after supervision. And as before, we have the states color coded. So what you're seeing right now is our best powered state, state 1. We have each of the 4 protective factor domains listed here at the bottom. So pro-social identity was one domain, pro-social engagement, including purpose, social support, so peer and caregiver support, and finally self-control and self-efficacy. What you're looking at is the hazard ratio. So this is the risk of reoffending after supervision. Lower is better. So it's really important for you to read these charts with an emphasis on looking for significance happening below the line that's drawn here, which is 1. So 1 means there's no difference. What this shows is that in the best powered state, pro-social identity, pro-social engagement, and support of both kinds, peer and caregiver, we're adding unique value to risk in predicting any reoffending. If we click on the slide, we can see that that is not so true for state 2, or clicking again, state 3. So in our less powered states, we don't see much of a protective factor by domain after we control for young people's risk of reoffending. This is true when we're looking at any kind of reoffending. If we go to the next slide, this is a slightly different story when we shift focus to violent reoffending. So now we're looking at the more serious form of reoffending after supervision. What you can see here is that self-control and self-efficacy add value to risk in predicting violent recidivism across states. So you see that in the last block here to the far right, self-control and self-efficacy, we have significant protective effects in state 1 and state 3. But in our largest state, so again, the state that we talked most about on the previous slide, we have other domains that are adding predictive value too. So a sense of purpose is protective, and also social supports are protective in our best powered state, the state that's most capable of detecting smaller effects. Okay. We also asked a question about whether protective factors vary in how strong they are by a young person's age, and found some pretty exciting effects here, just as we did when we looked at risk factors in the first brief. This is one of the first studies to really recognize that the juvenile justice system covers people who are really young, 12, 13, 14, and quite a bit older. So we wanted to see whether the strength of these protective factors varied by kids' age. And what we found is that the youngest youth were most strongly protected by school connectedness. So the more bonded they felt to their school, the more protective that was, especially for young people, and to a lesser extent for older people. In our best powered state, we also found that having a strong sense of your future self as pro-social and wanting that mattered, and also having a sense of purpose, that there's something that you care about, or there's something that you're pursuing in life in terms of school or life goals, also mattered. And if we go to the next slide, you can see a graph. It's kind of hard to wrap your head around that finding, but what this shows you is the likelihood of being able to survive in the community after supervision without reoffending. So higher scores here are better. And what we're looking at is how high the young person scored on school connectedness, so how bonded they felt to the people at school and school as an institution. You can see that there's a sharp slope upward. So as young people, if we anchor this to age 10, as their school connectedness increases, their likelihood of surviving and having positive outcomes, not reoffending in the community, sharply increases. We also see a nice upward slope for kids with an anchor around age 14. And it doesn't seem to matter nearly as much for the much older kids. So if we summarize this in the next slide, we have some exciting and very novel findings. The first is this is the first study that used validated self-report measures of carefully selected protective factors. And we found first that we can validly assess these factors among young people. Even the youngest ones were able to do these self-report surveys, and their scores on these protective factors mattered. So we're trying to measure protective factors, and they do seem to protect young people against reoffending. Our next conclusion is that all 4 of the domains that we measured can protect young people against reoffending, but across contexts, the ones that emerged the most consistently, not necessarily the strongest, but most consistently, were self-control. So being able to control your behavioral and emotional impulses, and also a sense of self-efficacy or an ability to handle life's difficulties were the most protective across contexts. We also found that after we controlled for young people's cumulative likelihood of reoffending based on really good tools, that pro-social identity, pro-social engagement, especially a sense of purpose, and social support, like peer and family support, added value to predicting any reoffending after supervision in our best powered context. If we shift to violent reoffending, self-control and self-efficacy were the most consistently protective across settings, but the other domains that are more about adolescents also added value in that best powered context. So the last finding here is that development matters. This may not be surprising to you given your backgrounds in this webinar, but some protective factors are stronger for younger youth, like school connectedness, and maybe really having a strong sense that your future self can be pro-social and that you are doing something that matters or you have a sense of purpose. So implications here are pretty straightforward on one sense. The first is that it may make sense for agencies to add a survey of protective factors to their intake process. This seems like low-hanging fruit in some ways. It's something that youth can do while they're waiting for an appointment, for example, and it does seem to add value, and it can also change the conversation to some extent. When you're really focused on young people as young people, who have identities, who have a sense of purpose, who have different levels of self-efficacy. So adding a survey to the intake process is one thing. Targeting influential protective factors like self-control or self-efficacy could be really important for case planning and supervision and decision-making about services. There's a lot that we need to develop in terms of guidance here. These are very new findings. But we'll pick this theme up a little bit later. It is possible that things like social skills training or family-based interventions or like even strengths-based activities that try to build pro-social attachments could also build self-control and self-efficacy. But the important point is that we should start thinking about these things in our supervision. Finally, potentially prioritizing protective factors, especially for younger youth, seems important. And finally, this is very new, right? So compared to risk, need, responsivity, or talking about risk factors, there's a lot of enthusiasm, but probably less research when it comes to strengths-based services and approaches. So this is a really exciting sign that building the evidence base for what works to build these strengths, these particular protective factors that actually prevent recidivism, is a really exciting new frontier. Back to Dr. Vincent.
Thank you, Dr. Skeem. Okay, so very exciting work there. So we're going to launch into now our second research question here, which I am particularly excited about, which has to do with what is the influence of strengths-based services? What influence do those have on recidivism, reoffending? And again, we focused only on post-supervision reoffending. So they're done with the juvenile justice system. What are they doing now for the next year and a half? And our emphasis was on violent recidivism. In order to answer this question, a lot of work had to go in from the states, with our research team, to get all of the services youth were receiving for the entire time that they were involved with the system. And that took quite a bit of work. So I'm going to break down how that went before again turning it over to Dr. Skeem, who gives you the results. First of all, two of our states had very nice case management systems already in place where they already were accustomed to entering service data, but maybe not all probation officers in all counties entered service data. Another one of our states was not accustomed to entering service data at all, so we created a service module with them where they could do that for the purposes of this study. We had to first define for everyone what we mean by a service, because in order to isolate the impact of any one service or any group of services, you need to really know everything the youth is getting at that time during their supervision in the juvenile justice system. And that meant really broadening the type of data that was being gathered by these agencies. And I don't think any juvenile justice agencies are necessarily gathering service data to this extent or at this level. And so again, just a huge acknowledgement to our states for doing this with us. So we define services as anything rehabilitative, any activity that is meant to be pro-social. It couldn't be things like that we consider to be generally conditions like community service, restitution, GPS, drug testing. Those are not services in our mind, not for this study. We're talking about something rehabilitative, some program or some activity that is designed specifically to intervene and help youth get better. So this included any service, regardless of whether the youth and family referred themselves there or the juvenile justice system referred them there. So if they came into the system already getting mental health counseling, that would have been tracked and included, and it would have been in our data if they were still getting it during the time they were involved with juvenile justice. It included any activities they were doing in the education system that was additional to just going to school. So extracurricular activities, if they were on the basketball team, for example, if they were getting tutoring, that would be another example of an education-related service. Any activities from the child welfare system or the mental health system. Another great feature of this was that any services that were delivered by probation officers one-on-one. So many of our states did the carry guides or they did epics, which were the carry guides are modules that they follow to address particular risk factors with youth. So any of that one-on-one time was considered a service. And finally, we also not only included services youth were receiving in the community, but a fair percentage of our youth ended up in placement, like a detention facility or residential facility or group home at some point during their supervision. Any services they received there were also entered. So it was a very robust data system. We tracked services from the time they entered the system. Actually, we cut that off at the time of their protective factor survey or risk assessment, up until their case closed. You spent an average of 283 days in services, but obviously this data is very skewed. There was a really wide range there. Some got more services than others. And we trained all the probation officers how to define a service, and we then had them enter all of those data. Their states had them enter all of those data, and we did quality assurance checks on it every 3 months and went back to them with questions if something was missing. And I attribute that to our staff, Kayla Carew, Jennifer Pendleton, and Carly Rice. So we also then needed to determine what is our operational definition of a strengths-based service, and how to separate that from a risk reduction service or a responsivity-based service. We enlisted the help of 3 experts here that are well known in the field and certainly experts in this area: Mark Lipsey, Jeff Butts, who talks about the positive youth justice model. We really attribute that to him. And Pamela Rose Buckley, who is a professor and also is involved with the Healthy Blueprints for Youth website that is constantly looking at evidence-based programming. We defined strengths-based services as services promoting competence and skill building, pro-social engagements, and/or pro-social attachment to be consistent with the positive youth development model. And we sent everybody a list of services and asked each of these folks to independently rate whether the service was risk, strengths, not a service at all, or responsivity only. And clearly there's going to be overlap there, so we had to identify kind of one of those categories for each service. Some examples of strengths-based services, which are the focus today, are things like Big Brothers Big Sisters and other similar kinds of mentoring programs. Anything that involves pro-social skills or social skills training, vocational training, work placement, school-based interventions that involve extracurricular activities, so they're on the football team, any voluntary volunteer work, restoration programs with victim mediation. That was important that piece had to be in there. And these are just some examples of what would be considered strengths-based. Okay. I want to give you a sense of how robust this data system was. For 2 of our states, we got data from them retrospectively. So before we started gathering the protective factor survey and before we started intervening and working with states to expand their service data capacities. 2 of these states, and this shows you the number of services that were entered for the 2-year period for the sample. We got similar size sample before we started working with them around their service data capacity versus the amount of services that were entered for the 2-year period after that. So consistent numbers of periods. We pulled it out for just the counties we were working with. And you can see in state 1 a dramatic increase, and in state 2 it looks like a decrease. But you have to remember, this was post-COVID on the after side, and so there are far fewer youth referrals at that time. So if you look at the number of services this equals per youth who were in the system, there was a great increase where almost 3 services per youth were being entered in state 1 after we did this service data capacity update. And over 1 service for every youth in state 3 was being entered. So they more than doubled their service to youth ratio. It's very important to make the point here that there was no changes during this time, or very few changes in service delivery for the juvenile justice systems. This is simply a function of the fact that they are now entering everything youth are receiving. And I think that's important for all of us to keep in mind when we're sort of interpreting any service data studies that have been done up to this point that have been based on administrative data, including my own. I don't trust any of them anymore now that we've seen how many services were potentially missing before. And this was across the board. The types of service entry increased. I want to just bring your attention to the strengths-based services. So hardly any strengths-based services were entered by states prior to this intervention that we made with increasing their service data capacity. And that's not surprising because these are typically free services. They're not necessarily required in use conditions. They're not necessarily part of the case management plan. So they just weren't being entered at all, which makes it very difficult for any researchers to go in and see what the influence is of strengths-based services. So you first, if you're a researcher in the room, or even if you're in the research unit of a juvenile justice agency, the first step is going to be to increase the service data capacity before analyzing the influence of services. So just very quickly, I'm going to tell you what youth got with respect to strengths-based services. So over 2,000 youth in our over 3,000 youth sample received at least 1 service during the time they were involved with the juvenile justice system. And remember, again, many youth were just kind of sent home, counseled, and closed right from the beginning. So there were no services for them. So a good chunk, though, received at least 1 service. Half of that chunk received at least 1 strengths-based service, okay? When we looked at the strengths-based services and broke them down, there is quite a hodgepodge of services in here in this category, but the most common type of strengths-based service that youth were receiving or participating in was some kind of work placement or job skills training. That was 22% of our sample among the youth who received a strengths-based service, or received any service rather. A little over 6% were engaged in some kind of recreational activity that was structured, like it could be football, it could be a basketball team, it could be some other YMCA, something like that. And about 6% were involved in some kind of mentoring program. We're going to be analyzing data based on the dosage units per month of supervision. This is kind of a tricky concept, an index of how much service people got. But essentially what this is we looked at the duration of the service. So it started in May and ended in August. Let's say that would be 2 months that service lasted. And we divided that by the number of months that you spent on supervision to come up with a service, with a dosage unit calculation. We multiplied that times 2 for any intensive services to weight those differently. And you can see youth in this sample, among those who received a strengths-based service, on average, they weren't getting a high dosage. On average, they were getting less than 1 day a month of strengths-based services during the time they were on supervision. Now, keep in mind, this is very skewed because a lot of youth in our sample didn't get any strengths-based services, about half of them. So that's why that looks that way. Who got strengths-based services? Who was more likely to get them? Again, we're looking at the dosage units here. So we can see the low-risk youth were engaging in far more strengths-based services than moderate or high-risk youth. Keep in mind, some of these would have been because they were referred by the juvenile justice system, but others are because the youth just referred themselves and engaged in the service themselves. So it's much higher among low-risk youth, and it was also higher among older youth, which makes sense given the most common strengths-based service that we had in our data was work placement or job skills training. Okay, and now I'm going to turn it over to Dr. Skeem, to go through the results.
You can call me whatever you'd like.
All right.
All right. So the first thing to say is that it's not easy to draw strong inferences about whether these strengths-based services caused increases or decreases in reoffending, because this is an observational study. With that said, we used some pretty rigorous statistical analyses to try to approximate a control group. And the results that I'm going to share here used a technique that we call inverse propensity score weighting. What we are doing here is trying to control for baseline variables, so characteristics of young people when they come into probation that could be associated with their likelihood of getting strengths-based services. Things like their risk level. So we just saw that lower risk people were more likely to get them, but also their demographic characteristics, their socioeconomic status, which could make a difference on whether they get strengths-based services or not, their disposition, and also their severity of offense. So we took all of those baseline characteristics into account and created basically a propensity score that indicated the young person's likelihood of getting strengths-based services given who they were at baseline. And then we sort of matched youth on that so that we get a sense for the impact of strengths-based services, setting aside all of those features that could have made some people more likely to get them than others. And what you can see with the headline here is that young people who participated in any strengths-based services were more likely to reoffend post-supervision than those who did not. So you can see this, what we have here is the hazard ratio. So again, this is the likelihood of surviving in the community without reoffending after supervision. We would really be looking for our bars to be below this solid black horizontal line here, which would mean there's no relationship between getting strengths-based services and reoffending. We were really hoping to see that the bars would be beneath that, much like we saw for the protective factors. We saw the protective factors do protect against reoffending, but when we shift the focus to strengths-based services that people are choosing or being referred to out in the wild, what we see is that we get a significant but small increase in the likelihood of reoffending in not just one, but if we click, we'll see the other state where we have services data. So in both of these states, the state where we're best powered and have the biggest sample size is state 1, but also in the other state where we have service data, state 3, we see that compared to those who didn't participate in strengths-based services, those who did were more likely to have any form of recidivism post-supervision, and at a more troubling level, a bit more likely also to have serious or violent reoffending post-supervision. So we have tested and poked this finding pretty thoroughly already. We intend to keep doing that in the future, but you should know that we observed the same pattern of results when we used a different analytic strategy that uses machine learning called targeted likelihood maximum estimation, or TMLE. And we also saw the same findings when we excluded youth who were in placement, who we suspected might be influencing the results. So this seems to be a robust finding. And to just kind of give you a sense for what this means, if we take this bar here for state 1 and violent reoffending, what this tells us basically is that the odds of violent reoffending are about 28% higher among those who participated in strengths-based services compared to the odds for those who did not post-supervision. So next slide. These were not the results we hoped for, but we think we can draw some key conclusions for now, and also really use these results to figure out where we need to focus next. So in terms of conclusions for this first look at strengths-based services, again, this is a unique data set. It's the first time this has really been done. And we need to remember that these are self-referred or probation or other people referred. So the first thing that we are very certain about is that low-risk youth were the most likely to engage in or receive strengths-based services. We also know that maybe low-risk youth have more structured leisure time, for example. So that is to be expected. The second conclusion is that the most common strengths-based services that youth participated in, so work placements and recreational activities like clubs or sports, they probably vary tremendously in their focus, tremendously in their quality. And it's really important to remember and recognize that those services or activities, they do not see it necessarily as their job to reduce reoffending. They may not see it as their job even to promote more self-control or self-efficacy. So it's really, again, important to realize and recognize that this is just a description of the services that would be recognized as strengths-based based on our categorization system. But it doesn't necessarily mean that these were intentional or had a lot of guidance behind them in their prescription. And finally, we see that strengths-based services are associated with an increase in the likelihood of reoffending, which would be the opposite of what we hope. So if this finding holds up, it could be for a variety of reasons. One of the important things to remember is that what we know about what works is often disconnected from what we do in practice. And what we know about what works when it comes to strengths-based services is pretty limited. So setting that aside, if it is the case that strengths-based services are associated with increased likelihood of reoffending, it could be because the services that youth participated in were not the services that are evidence-based. So life skills training, for example, is an evidence-based, strengths-based practice, but doesn't appear very often in what our youth received most routinely. Second, it's not clear which of these services actually enhance or increase the protective factors that we found are really exciting in the first part of this study. So we know that some protective factors like self-control and self-efficacy really can protect young people against reoffending. It's also quite possible that some of these, that a good strengths-based service like life skills training could also decrease some of the robust risk factors we know can predict reoffending. But we're kind of at the beginning of building knowledge about strengths-based services, so we don't really know which of them are going to work on those mechanisms, like increased strengths or decreased risk. Especially compared to the risk side of juvenile justice, there's less empirical guidance about how best to implement strengths-based services, like who they should be for, what they should focus on, how long they should be. And the last possibility, which may especially be true out there in the wild, where people are opting into services, is that some of the services could inadvertently exacerbate risk. So if you're combining lower and higher risk youth, for example, in some of these settings, as in any other setting, there could be a risk of contagion of delinquency from one peer to the next. Next. And that little star there said, this is an observational design. We are doing more refined analyses. I can't help but underscore that. So implications. First, these results are exciting in the sense that it indicates we have more to do for building the evidence base about what kind of interventions broadly, any kind of intervention, risk-based, strengths-based, other, which interventions actually do move the needle on some of these protective factors that we know can protect against reoffending. We need to know more about that. It's also important to develop and provide some guidance to agencies for how really to implement strengths-based services, how to begin viewing strengths-based services as a means toward preventing reoffending, in addition to promoting positive youth development or some of these protective factors. Next. So one of the take-home messages from us that we share in this brief is that the positive youth development model, perhaps like the risk need responsivity model, is not necessarily a one-size-fits-all approach. In fact, that's one of the findings we would take from this, that when you just group together all of the services that would be categorized in our expert-informed system as strength-based, if you look at them as a whole, we're not seeing the effects we would hope for. So we may have a lot to learn, just as we did on the risk side, about how best to implement PYD. So we need to return to the principle of individualizing case plans and services based on assessments of youth, not just risk factors, but also strengths. Second and third, these next 2 points are just a really fundamental lesson of this study that will thread through all of the briefs. And that is that it's really important, especially in these times, to invest in deliberately partnerships and service processes and really make sure that we're collecting data and measuring what we're doing so that we can know whether it's working, when it's not. If we don't know what we're doing, we're not recording what we're doing, it's hard to know how to do better. So these points are about investing in service processes and partnerships, and at the same time, trying to really improve data collection and analysis, as we did in this study, on the services that young people are receiving, their dosages, and relating that to their outcomes. And finally, one of the bigger take-home messages is that it seems really important to pilot and evaluate approaches, different kinds of services, activities that could specifically enhance self-control and self-efficacy, which we found was one of the most robust protective factors in this study. There isn't a lot out there in the literature, but there are some meta-analyses at least that indicate that at least 2 strategies have some promise here. One is social skills training that targets personal responsibility, conflict resolution, model behavior, etc. So social skills training may have some value for improving self-control and self-efficacy among justice-involved young people, but we could do better with our evidence base. And second, family-based interventions like parent management training or MST could also be helpful for self-control and self-efficacy. And it's worth pointing out that in the positive youth development model, building young people's attachments to pro-social others like family members, pro-social adults, peers, all of that could be viewed as a mechanism for increasing people's own self-control, like their internalization of self-control. So there are some promising directions, but we need to do more. I will stop there.
Thank you, Dr. Skeem. So we have a few discussion questions. I've been trying to address some of the questions in the chat. There's a number of others. But as you will not be surprised, folks have a lot of questions around the service data. So Dr. Skeem, I'm wondering if we could first start. Can you talk a little bit more about the strength-based services data? And there were questions about, did this include kids in placement or not? How did we factor in young people getting some services, strength-based services versus a lot of services? Were we able to account for confounding factors like different mental health conditions? So if you can, I think, share with the group a little bit more detail about the data that we have access to in the population.
Yes, so I think that was for me.
Yes.
Okay, so the short answer to those questions is that we considered all of those very excellent points and addressed them in the analyses that we've completed. So we find the same pattern of iatrogenic effects, right? So services predicting reoffending in the wrong way. Whether we exclude young people who were in placement or not. So placement doesn't seem to be a confound that explains the results. We also see the same pattern of results when we disaggregate the strengths-based services by whether young people got some or a lot of them. So same pattern of results that we see as when we look at them as binary. In other words, you received them or you didn't. We also see this, we're seeing these results, whether we use propensity score matching or TMLE, with a very, very rich set of covariates. So we have great baseline measures of young people across a host of risk factors. We have all kinds of measures of young people at baseline, and we're controlling for and considering their demographic characteristics, their SES, their risk, their offense, the type of supervision or disposition that they had, everything that you could imagine would potentially relate to whether they got strengths-based services or not were included in our list of covariates. So again, this is not an experiment, so it would be a mistake to be really, really confident in these findings because we have not randomly assigned young people to get strengths-based services or not, but I think that we have done the best we can with this first look of services that were actually received by young people and trying to account for a host of alternative explanations.
Can I just add, Josh, to that? That first of all, the kids who went to placement really didn't receive much strengths-based services anyway. That's not typically what the placements are getting, but as Jen mentioned, we looked, at these analyses with and without them, but they typically were not getting a ton of strengths-based services during their placement. Just another point, because someone asked about the mental health, someone's asked about the IQ. As Jen mentioned, we have a lot of good demographic data, but those we do not have. So we were not able to control for mental health conditions or learning disabilities or IQ in any of the analyses in this study. They're just not reliably and validly gathered by all of these counties. So that wasn't something that we were able to do. And I also want to just reiterate, as both Jen and I have been saying, that this is strengths-based services as a whole. There is a kind of a hodgepodge of services within that mix, even though they all meet our definition. it's very possible that some strengths-based services maybe had great effects. And we haven't broken it down that way yet, in part because we're going to get smaller and smaller samples when we do, but that may be something we could do in the future. You're muted, Josh.
Of course I am. General question here, which is it's hard not to hear about these findings and feel discouraged, and to feel like this reinforces kind of a decades-old conversation in the field that nothing works for these kids, and there's certainly increasing pressure on juvenile justice systems to focus on more accountability type of interventions. So can you both talk about, is that what jurisdictions should be taking away from our findings, particularly discouraging that strength-based services, which one would hope would have at least a neutral effect, if not a positive effect, are having a negative finding? And if not that, kind of what would you encourage jurisdictions to kind of think about and do with this information instead? And Dr. Vincent, if you want to start.
Yeah, that's a great question. So I'm gonna throw out a couple of ideas and then I know Jen has some thoughts. So short answer is no. I hope no one is taking this as evidence that we should go back to accountability only and not be giving youth the opportunity for strengths-based services and pro-social activities and mentoring and all of that. All of the good stuff that is included in here. I think that this is a first cut looking at strengths-based services, and that there's a lot more to look at. So there's one future direction I would say is we want to see if there's particular strengths-based services that are doing better than others to the best of our ability. So work placement and job training maybe is, we don't know. Mentoring would make sense that it would be if it's a good high quality program. We haven't looked at services based on whether they're evidence-based or not. So we haven't taken quality into account. I think that's another consideration here. But also, I think if I had any advice to give right now, it would be to be very intentional about who's getting strengths-based services and who's not. If you're the one referring them, because many of these are self-referred by the youth as well, but to be intentional about that. So are we mixing low and high risk youth in these services? If so, we may want to take another look at that and try not to do that. Are we picking strengths-based services that are addressing that are going to increase the protective factors that we know matter the most? It doesn't look like that was necessarily the case here. So there is some intentionality that can go into that when selecting them. And lastly, I'm just really not sure that many of that youth are being put into some of these services like job training and work placement after already addressing some of their risk factors that are going to impact their performance in job training and work placement, or at least doing it in conjunction with their job training and work placement. So for example, if you have someone who's impulsive, has poor, challenges with anger control, is not responsible and so on, and we just put them in a work placement environment without very good supports and as some peer supporter or coach or counselor working with them on those other issues, it may just not be effective. And so I think we're just talking about more intentionality. Those are my thoughts. Moving on to Jen.
So I hope that is not the message that people take away, that nothing works, because we know already that a lot of things work. There's a whole literature on what works, and some of it is about principles that have been shown to work, like making sure that the higher risk young people get more and appropriate services, and some of which are just packaged programs like functional family therapy. So we know a lot about what works, and I take these findings as a sign of where we are in the development of a similar evidence-based for positive youth development or strengths-based services. We have really exciting results that tell us what appropriate targets are for these strengths-based services, which is really exciting. So, that tells us what needs to be addressed. And the next step really is to figure out what works, right? So if strengths-based services view it as their job to increase or improve some of those targets, those protective factors that really matter. Those may be the ones that make a difference when it comes to reoffending. We see the same thing in the risk-based side of the house, in the sense that unless and until we're deliberate about this and we really view focusing on strengths, not just as a general approach, but something that has specific targets that we can seek to improve and specific ways of accomplishing those ends. And we really view it as our job to keep young people out of the system, in addition to building their most positive future self, like identity, purpose. There's so much here that really is about a positive future. I'm doing a long and discombobulated job of saying that I think what we need to do here is take away that we have really exciting targets to focus on for young people to promote their development. And we know that that will prevent reoffending. And our job now is to start digging in the same way we have for risk-based services to figure out what works. Who should we be providing these to? We know what we should be focusing on as targets, but how should we be doing this? Like which services are going to accomplish this best? What are the principles? Some of those are articulated in the model. We need to test them. What are the services, et cetera? So I think this is just first base, really, and provides some focus for more development.
Yeah. Thank you for those comments. I'll add my own 2 cents here, because I think this is such an important issue. I do think the word that Dr. Vincent used and Dr. Skeem obviously emphasized as well is intentionality. As Dr. Skeem mentioned, when it comes to strength-based services, maybe we don't know enough about how to be intentional, but one of the takeaways which we emphasize in the first brief is that minimum operating from a principle of do no harm. And the first brief, as well as the second brief, really reinforced the importance of trying to keep the lower risk kids out of the juvenile justice system, because we have robust past research that justice system involvement can, in fact, do harm. And our findings do replicate findings in other spaces that shows that services are not always a good thing. And what the protective factor study really further extends to show even services that you would assume, strength-based services, job placement, mentoring, that would automatically be a good thing, are not necessarily a good thing. And so I think that a starting place for jurisdictions to start is to really be thoughtful both at the individual level as well as the systems level about what population of youth really requires system involvement, what youth really require services, really understanding what those service environments look like, and are we just aggregating a bunch of higher risk kids together? Are those services really targeting the individualized risk factors and some of those priority risk factors that we talk about in the first brief? And what are your relationships with service providers so that you know providers are providing those kind of individualized approaches, and do you have quality assurance and fidelity measures? And I think as a preview, and Dr. Skeem might talk about this a little bit more, the third analysis, and we will have a third brief and a third webinar, is going to kind of reinforce the importance of this, not just for strength-based services, but all types of services. I think that's a good segue. And Dr. Skeem, maybe start with you about, just as you take a step back, thinking about our first brief and now this brief and the analysis that we have done to date, what has surprised you the most, and what do you think the implications of that information is so far?
So I think what has surprised me the most is the protective factor findings. So we chose those protective factors very carefully, and I'm excited about them because we're measuring strengths not as, you know, something that's embedded in the risk assessment tool where you check a box if it's the opposite. We actually got measures that have been validated so that we know they measure what they say they measure. So we're actually getting at whether people see their future self as pro-social, kind, trustworthy, etc., and whether they value that. So I'm surprised that the protective factors did as well as they did and added value to the risk factors in mattering for post-supervision recidivism, even violent recidivism. I'm also really excited about our first, like, again, this is the first look at that question developmentally. So seeing that some of these factors are particularly important for young people is also really exciting. So I was surprised by those findings. I'm excited about them. And I think that I would like to view the other surprising finding, which is the adverse effect of just the whole lump of strengths-based services. I would like to recast that finding as an opportunity to really get serious in the field about defining what works for whom and in what way.
Thank you, Dr. Skeem. Just before we pivot to Dr. Vincent, there was a couple of questions just wanting more information about how the protective factor survey was developed. I know that could probably be its own webinar, but can you just give a little bit more information about how that was constructed?
Yeah, so I'll do the quick version. We first identified the constructs, like the concepts that we thought would make the biggest difference. And in choosing them, we wanted really to make them developmentally relevant. So young people want to matter, like we all want to matter, but young people really want to matter. And they're also figuring out who they are, and they're also developing self-control. So one of the concepts that we really used in choosing the protective factors is that they would be developmentally relevant, that they're relevant to the tasks of transitioning into a successful adulthood. Another principle was that, in a related sense, but not the same, that they're emphasized in the positive youth development and strengths-based literature. And the last was that there was at least some glimmer, some evidence to suggest that they would also matter for reoffending, whether they had been studied with adults, as pro-social identity has been, or with young people. So we used those three criteria, and then we went to the literature to try to figure out if there were really, really good, already published, already validated, and brief self-report measures of those constructs. So that's how we landed on the 4 domains we did. And
Thank
Dr.
you.
Vincent may have more.
And just one quick point before Gina kills me. You said something important there that I do want to make sure to emphasize for folks. We mentioned this in the brief, but what we were looking at was the relationship between strength-based services and recidivism. We did not examine participation in strength-based services and how that might impact education or employment or family functioning or other potential positive youth development outcomes. And that's a really important point. So just as folks take this information away and digest it, we're not saying that positive youth development approaches may not be, incredibly impactful in those domains, but this was one of the first and real serious looks at its impact on recidivism. And as we've emphasized, what's clear is we need to know a lot more before we can wholesale say that positive youth development approaches are an effective recidivism reduction approach. Dr. Vincent?
So just to piggyback on the development of the protective factor survey, we went into all those measures at the beginning of the session. There were a few that we knocked out because it ended up being too long. We did a lot of beta testing to see how long this would take, and all of our youth who had lived experience were doing it in a short period of time, but probation officers were telling us it was taking much longer than that with their youth. So we knocked some things out. We had attention checks in there to make sure that youth were actually answering legitimately. We did not include protective factor surveys if there was evidence that they were not valid. And we also had to modify the language to make it even a little bit younger for a number of these questions to make sure that everybody understood. So I just wanted to emphasize those points for the protective factor survey too. And they could do it on computer, text on their phone, or on paper. So that Josh had also asked that what was the question that you asked initially? Oh, yes, that what was the most surprising, what surprised me the most about the study? I would echo what Jen said. I was surprised also by the influence of the protective factors and how strongly protective they were, and that some of them even had incremental predictive validity over the risk factors or the risk level. I do think when it comes to self-control, there's a lot of overlap between self-control as a protective factor and self-control as a lack of self-control as a risk factor. And so I want to consider that when we're thinking about the fact that that was the most consistently relevant one. That I think we know that that is really important. Youth who have more control over their behavior and emotions are going to do better, for example, in a work placement or in a sport or in some of the other strengths-based services. So that was a big finding for me. There were, just like Jen said, there were two other big findings that I think were important. One, which Josh mentioned at the very beginning, I am surprised at how many low-risk youth are still getting referred to the juvenile justice system. So about 50%, 40 to 50% of our whole sample was low risk. And I think that that's something that we want to pay attention to, figure out maybe in our systems why that's still happening. Granted, many of them got handled informally, but there wasn't a percentage of them who ended up on probation for sure. A second really surprising finding for me was I just want to emphasize again the importance of enhancing and increasing service data capacity. And we picked states based on knowing that they had good service data capacity and they had been tracking services for years. And still, this added significantly more services to their data tracking. And I think if we want to answer more questions like this and really isolate what services are getting the biggest return on investment, it's going to be critically important to try and enhance those service data systems.
Yeah, thank you for that. I know we only have a few minutes left. Dr. Vincent, do you want to start and give folks a preview of what's to come? Because while we've had some really important and unprecedented findings, I think we've got some additional analysis that will also have important implications for the field.
Yes, so the next brief that's to come is going to be similar to the first brief we came out with, but different. It's the first brief we came out with plus. So the next brief to come is going to look again at what risk factors are most predictive of violent recidivism post-supervision. So here we really focused on protective factors. The next one is going to focus on risk factors. We did find some interesting results there and consistencies across the states, despite the fact that they were using different risk assessment instruments, all validated risk assessment instruments. We also found some developmental differences there that were consistent with what we found initially with our retrospective data. So this was a prospective sample, very current, and we're going to be reporting the influence of risk factors. We're also going to be reporting what Jen just reported for the strengths-based services. We're going to be reporting that for the risk reduction services. And what kinds of risk reduction services kids are getting, how much are they getting, and is it having any influence on recidivism?
Skeem, anything you want to add to that?
No, that was well put.
Thank you.
Great. Well, thank you all. We appreciate your time and interest. As noted, the slides and the recording will be sent out to everybody that registered. And we know that these findings have, deep implications for the work that many of you are doing. So if you are interested in discussing them more, and if there are ways that we could potentially support your jurisdictions in this work, please feel free to reach out to me directly, because we think this is a critical and a fragile time for juvenile justice systems across the country, and we want to do the best that we can to make sure this research is relevant and useful to you as you do your important work. Thank you all for your time.